welcome to the Global Communiques In-Depth Conversations. As the world grapples with the pandemic, which has on the one hand caused a health emergency and on the other hand an economic crisis, African countries have revealed their resilience in tackling this challenge. As of 21 October 2020, there are just over 1.66 million reported COVID-19 cases in Africa, and just over 40,000 related deaths on the continent, relative to the global numbers that currently stand at 41.1 million total cases and 1.1 million deaths. At first, there were nightmarish scenarios that were anticipated for the continent's handling of the virus. Then there was utter surprise at the relatively lower than expected numbers of COVID-19 cases. Today, to help us unpack details about Africa's response to handling the COVID-19 pandemic, we are joined by Dr. John Nkengasong. Dr. John Nkengasong, thank you for taking the time to speak to us today.
Thank you.
Dr. Nkengasong is Director of the Africa Centers for Disease Control and Prevention, a technical institution of the African Union. He is also the World Health Organization's Special Envoy for Africa on COVID-19. Prior to his current role at the Africa CDC, he held various other positions, among others at the US CDC, as well as the Institute of Tropical Medicine's Department of Microbiology in Belgium. He has also been recognized for his work in public health and has been awarded with awards, among others, the CDC's William Watson Medal of Excellence, and more recently, the Global Goalkeeper Award. So I will jump right into the questions. The first case of COVID-19 in Africa was reported in Egypt in February. And then different African countries started to report their first cases, Nigeria, Algeria, and so it began. Given the fast-moving nature and novelty of this virus, what level of support has the Africa CDC been providing at the continental level to African countries at this time of a pandemic?
No, thank you. The Africa CDC recognized that we had an imminent threat way back in January. And if you search the literature, you will see that I actually wrote a piece in Nature Medicine and published on the 27th of January, where at that time, there were only 200 cases of COVID-19 in the world. And they were still very limited to China, Singapore, and Hong Kong, and Thailand, very, very few limited cases. And we immediately recognized that it was going to be a threat, a serious threat on the continent, and we needed to prepare ourselves. And that it was a question of time before COVID will arrive on the continent. So that is a good starting point, because it was an alert that we raised for the continent. So Africa CDC has been supporting the member states at two major levels. One, at the coordination level. I mean, we very early on, as you indicated, when the first cases of COVID-19 were reported in Egypt, we convened a very high-level meeting of all ministers of health in Addis Ababa to agree on two things. One was to agree that we needed a joint continental strategy that was underpinned by the need to coordinate our efforts, to cooperate, to collaborate, and to communicate better. And second was the task force that we established, the Continental Task Force for COVID-19. At that time, it was preparation, to prepare the continent for the imminent arrival of the virus. And so that was a good starting point. And I think when the ministers came to Addis Ababa on February 22nd, it was a unique opportunity for us to raise an alarm, and also a unique opportunity for us to agree on what measures to take once we were hit with the virus, because we saw the devastation that the virus was creating in Europe and in China. And we said, well, there was no way any African country would have the means to build a 2,000-bed hospital in 2 weeks like they did in China. So the best thing was to develop prevention measures there. So that is one. One is the level of coordination. Then we took that joint strategy to the level of the head of states, that is Africa CDC, and they endorsed it on the 26th of March, what is commonly called a joint continental strategy for COVID response on the continent. So it has been a very important platform to coordinate activities across the continent, across ministers of health, ministers of transport, ministers of finance, headed by President Cyril Ramaphosa. So that is the coordination and policy side. On the technical side, we immediately, even before COVID hitting the continent, organized ourselves in such a manner that we started training countries to be able to know how to diagnose it. Remember, the first cases were in February 14 in Egypt. But on February 8, we had already organized a large workshop in Senegal at the Institute Pasteur, where we brought 16 countries around February 8, 9, and 10 to train them. Luckily, those same people that were trained from Egypt and went back, they were able to detect the virus when it showed up in Egypt. So that was remarkable. Then on the 20th of February, we sent a second a group of countries to South Africa at the National Institute of Communicable Diseases to train them. And they were trained there, and within an interval of 3 weeks, the entire continent had been armed with the ability to test. And then we started with the scale up of diagnostics to really expand testing to countries and support them. Another area we actually started preparing the continent before the virus arrived was infection prevention control and measure. That is, how do we prevent the virus? How do hospitals prevent it? The third area of interest that we prepared the continent before the virus arrived was in the area of surveillance, enhanced surveillance at airports and ports of entry. And then the area of clinical case management. I mean, how do you manage COVID? All of these things were in place before the COVID, the cases started showing up in Nigeria. As a matter of fact, we're training more than 40 countries in Nigeria when the first cases were reported in Nigeria. So the staff that was, the Africa CDC staff that was in Nigeria just stayed on in Nigeria. And I mean, they only recently came back. So I think that is the level of preparedness that was in place in anticipation of the arrival of the virus. So in sum, we have been preparing the continent both at the political level and also at the technical level.
So with that said, you know, the public health infrastructure across the African continent varies, with some African countries being better resourced than others. What coordinated efforts have been put into place to assist countries that are not resourced to help in combating the coronavirus?
So I think, as I indicated, all countries have been supported. I think we had, and then we also have what I call differential support, which is, I mean, you deploy. We've since deployed more than 205 rapid responders. Like when we realized that the pandemic was raging in Mali, Burkina Faso, Niger, and Cameroon, we actually, in collaboration with the Peace and Security Council of the African Union, something that has never been done. I mean, we're able to hire a military plane. And remember at that time, the skies were all shut off. I mean, and the only way to move across the continent was if you had agreements for military planes to move. So we hired a plane through the Peace and Security Council of the AU from Cameroon. He went to DRC and brought 30 responders and dropped them in Cameroon, Niger, Burkina Faso, and Mali. Okay, and I think that is so that is a good example of supporting countries that we realized that they had a weaker health as epidemiologists to respond. We have since expanded that to deploying over 200 responders across multiple countries, about 22 countries in Africa. We also realized that when you test people, you have to trace them. And that is surveillance, that you need the community healthcare workers. As we speak, we have deployed over 10,000 community workers to support the testing and follow up across multiple countries. But importantly, in countries that we recognize that they have a weak ability to support the response. So I think we can go over and over. We've rolled out more than 6 million tests from Africa CDC, out of the about 17 million that has been conducted cumulatively across the continent. About 6 million tests. I mean, we've trained over 10,000 clinicians on how to manage COVID cases across the continent, and over 1,000 laboratory experts across all member states there. So it has been an extensive technical support that we've provided to all member states, but of course, with priority to some countries that cannot truly stand on their own.
Africa's context is different from that of other continents across the world. For example, global measures to limit contagion through lockdowns may be difficult to implement for those who work in the informal sector and rely heavily on being in the market, selling for their livelihood. And on the other hand, the difficulty of implementing physical distancing for those who live in overcrowded urban settings. How did the Africa CDC think through this to strategize and advise African countries to contextualize their responses to the pandemic in a way that did not simply copy and paste measures done in other countries that fundamentally differ from the African context?
You know, when people characterize it as such, I disagree with that, because I think public health measures are public health measures. It's not cut and paste in whatever the West also. When they couch it that way, we disagree. We think that if Africa didn't lock down, let me use the case of South Africa. If South Africa didn't lock down the way they did during the first wave, they would have been exactly where the United Kingdom is. Their curve was exactly mirroring that of the UK. And they were doubling every 2 days. So when they locked down at about 800 cases, that before the lockdown, every 2 days they were doubling. And when they locked down, that reduced it significantly. And I think that, and also offered them the possibility to equip themselves and position public health measures there. So when people say we just, copied what and paste from the West, is a false narrative. Now, the challenges that are there, of course, are the reality that a vast majority of our population live on an informal income. And I think with time, that's why most of these lockdowns, if you look at Ghana, South Africa, Nigeria, it was for a period of 4 weeks to 8 weeks, and then they released that almost very quickly. I mean, Ghana didn't even go up to a month, and that it was so important that the purpose of lockdown is not by itself a tool, but it's to say, look, we have been attacked. We have to fend the enemy and arm before you attack the enemy. Without that, remember, we had no diagnostics. Mm-hmm. We had trained people at the capital cities to diagnose, but there was no diagnostics across. So with those lockdowns and restriction of movement, we were able to channel the help to countries. I think that is, I mean, now the community approach was central to most countries. I know, be it in Rwanda. Rwanda is using a large number of community health workers. South Africa deployed up to about 30,000 community workers. That is very important. That you don't see that this community workers approach and engagement in Europe, in the United States. There are no community health workers in these countries. They rely on technology, where if you're infected, I mean, you surveillance systems, they pick that up, they report it. We use community health workers, I think, extensively, and engagement of the community. That should be acknowledged. And some of these lessons are borrowed from the Ebola outbreak in West Africa. If you look at the numbers in Liberia, Sierra Leone, Guinea, contact tracing has been very, very effective there because it's pushed by community workers, and they are borrowing from the experience from the Ebola outbreak in 2014. South Africa is using community health workers extensively, borrowing from the HIV pandemic that have struggled with community issues. That these are experiences that are not at all anywhere replicated. You don't see community health workers in the United States or in Europe.
Mm-hmm. Of course. So I guess this is almost leading on to what I was about to ask next, and that there were fears and nightmarish scenarios anticipated for the African continent, but it seems that many countries drew from their experience with dealing with various epidemics such as Ebola, as you've mentioned, with community health workers that are not necessarily in other countries. So there have been encouraging stories coming from the continent, for example, Senegal with its cost-effective COVID-19 test kit. And you also just mentioned Rwanda, and particularly Rwanda's use of medical robots to support hospital staff. Is there a single African country you can single out as having gotten its response to COVID-19 right among all the others? If so, which one?
Many countries. Nigeria, let me start with Nigeria. Imagine a scenario that Nigeria, the COVID cases in Nigeria went out of control. And Nigeria is a country of about 220-something million people. and there are currently around 60,000 cases of COVID. That's a success story by itself. And people say, when you prevent things, they become normal, okay? And but all we need to do is to stretch out and look at Brazil, okay, with a similar population like Nigeria, and look at India, similar developing countries. So that's a success story. South Africa is a success story. The definition of success is not that you don't have COVID cases, is that you have COVID cases and you can control the COVID cases. South Africa is reporting about 700,000 cases there, but they have been able to bend their curve nicely, okay, twice, okay. I think a lot of sacrifices, but they have done just that. Look at Togo. Togo has an app that they use for contact tracing, where you come in, you test, you have that app on your phone, and they can trace you whether you're actually isolating or not. I mean, they currently have probably one of the lowest cases across the continent. We're about 2,000 cases in Togo. Okay, and so there are many examples across the continent. That Rwanda, that we should be able to be proud of. My warning, anyway, to the continent is simple: that we are not out of the wood yet. This is a virus that spreads quickly. It tends to deceive you, and then places you in a mode of complacency, and then suddenly emerges rapidly. I'll give you 3 examples. If you look at the curve in Uganda, Uganda started very slowly, and suddenly they went up by almost 90-something%, very recently. Tunisia was almost had a perfect response. It's a very flat curve for so long until August. It went up to about 800%. Morocco was maintaining the curve very, very nicely, flattening it and maintaining it. But September, August, September, the curve went up. So I think many success stories in Africa, but my warning is that we are not out of the wood yet. COVID will be with us for a long time. We cannot relent from implementing our public health measures, and as we have done very, very effectively, which is the masking, the avoiding crowds as much as possible, using our communities as much as possible, enforcing surveillance as much as possible until vaccines become available. And even if they become available, we have to tie it all together with the existing public health measures.
Speaking about vaccines, what collaborations has the Africa CDC had with the pharmaceutical industry for the treatment of the virus? And how important are such partnerships and collaborative efforts with the pharmaceutical industry?
The Africa CDC continues to talk to the COVAX facility, which is the main stream process through which most countries will access vaccines. But the question is, would that be enough to cover the continent? So because we believe that the COVAX mechanism will provide us with some vaccines, but not all vaccines, we are talking to other companies as well. I mean, we've had discussions with AstraZeneca, we've had discussions with the Serum Institute in India, and we'll continue to have discussions. We are also thinking and elaborating our own financing mechanisms in the continent and as a whole, so that we have enough doses of vaccines when they become truly available. So we are engaging bilaterally. We've not yet finalized any deals, but we are in those discussions, and we are also discussing with the COVAX facility as well.
Okay, so on the 2nd of October 2020, South Africa and India, co-sponsored by Kenya and Eswatini, submitted a proposal to the World Trade Organization in which they sought to waive certain provisions of the WTO's rules governing intellectual property rules relating to COVID-19 related pharmaceutical products as a means to facilitate the development of lower cost COVID-19 diagnostics, treatments, and vaccines. In the proposal, they stated the following, and I quote, "It is important for WTO members to work together to ensure that intellectual property rights such as patents, industrial designs, copyright, and protection of undisclosed information do not create barriers to the timely access to affordable medical products, including vaccines and medicines and supply of medical products essential to combat COVID-19, end quote. As someone recognized for the Global Goalkeeper Award for championing access to effective and affordable vaccines for vulnerable populations, what are your views on the recent proposal put forward by these countries?
I think my views are those that support that position. And we had issued a statement on the 24th of June, when we convened a big meeting to discuss vaccines. And that meeting was chaired by Chairperson of the African Union, His Excellency President Cyril Ramaphosa, and the Chairperson of the African Union Commission, Chairperson Moussa Faki. And we issued a communique. I mean, you can Google and see that communique where we're asking for just exactly what you said. I mean, that is for those transfer of intellectual property so that companies or less resource and developing countries can have access to manufacturing. So, I mean, the short answer to that is that I endorse that position.
Okay, and it's interesting because in the council meeting at the WTO, the countries were sort of split in the middle. It was the low and middle income countries that stood on one side and supported the proposal, while some of the richer countries appeared to stand on the opposing side and did not support the proposal per se. So will the Africa CDC be getting behind this proposal with the African Union? Is this something that you will look into? Because apparently the decision has been suspended for a future date.
Yeah, we have to study that. We have not seen the entirety. I've just heard about that through the media. It's not a proposal that was vetted through the African Union. And I wish that it was vetted through the African Union in the spirit of being a collective to discuss. It wasn't. And I still need to look into the specifics of that before we can discuss and understand what to advise the African Union to stand behind it or not.
Okay. So most governmental efforts are focused on tackling the urgency of COVID-19. As the Africa CDC, are there any efforts simultaneously put in place to ensure that other killer diseases such as malaria, HIV/AIDS, neglected tropical diseases are not deprioritized and neglected across the African continent at this time?
Yeah, absolutely. We do, as part of our continental strategy, we are very clear that the third pillar of that strategy speaks to the effect of the harm that COVID can create on other diseases like malaria, HIV, and TB. So we talked about that openly. We advocate for that, and as much as possible, of course, in partnership and coordination with other partners like the Global Fund, of course, the WHO. Our position is very clear. HIV, malaria, TB kills about 1.2 million Africans a year. If those programs are undermined, it will be catastrophic for us as a continent.
As a final question, from a medical and contagion prevention point of view, what are your views on the widespread protests taking place in Nigeria and the effects this will have on the spread of COVID-19 in Africa's most populous country?
We watch that with a lot of concern. I think, again, we are advising all countries to avoid mass gathering because they will promote, of course, the spread of the virus. So I think we are very concerned with those mass demonstrations and gatherings in the context of the COVID we are fighting.
And any final advice for any listeners as we close this discussion?
Yeah, that the continent is not out of the wood yet. I mean, we really regret the 40,000 deaths, and our pandemic. We are beginning to see it edge up a little bit, and the continent should really remain focused and really deploy those public health measures that I have outlined clearly during our conversation.
Okay, we will leave it there. Thank you, Dr. Nkengasong, for taking the time to speak to me today on these pressing issues. And to everyone watching, thanks for watching.
Thank you. Thank you so much.